Thank you, Sandra. Yes, just to introduce myself, my name's Faye, and I'm the Cancer Rehab Ambassador Implementation Lead for the South East London Cancer Alliance. So I'm currently working on a project looking at implementing cancer rehabilitation across South East London. But by background, I'm a physiotherapist, and I've worked in oncology for a number of years at Guy's and St Thomas's, specialising in an outpatient service. So if we have my first slide, please. So I'm very passionate about all things cancer rehab, and I really could talk about this topic all day. But of course, when we talk about cancer rehabilitation, we're really thinking about a bit of an umbrella term that covers so many areas and so many professions. So this is an overview, really. It's a whistle-stop tour. Because I'm very conscious as well that we've got some really exciting speakers lined up. So if people have any burning questions at the end, will be some time at the end of my presentation, and you can raise your hand or put your question in the chat. But as I said, I'm keen to just give an overview about why rehab is so important. So we know that many people are being diagnosed with cancer. So it's estimated that currently there are 3 million people living with cancer, but this is continuing to rise. And by 2040, there'll be about 5.3 million people living with cancer. And on average, someone is diagnosed with cancer every 90 seconds in the UK. So incidence is rising, and this is likely due to the growing and aging population, and as they're at higher risk of developing cancer. And also we know that there have been some improvements in diagnostic initiatives and public awareness. Also, treatment techniques have radically improved the life expectancy for people diagnosed with cancer, and more people are living longer with cancer. Many people will experience the shock of a cancer diagnosis and will go on to undergo sometimes lengthy and intensive cancer treatment, and rehab can support them to prepare for their treatment and to maximise the outcomes of their treatment, and also to support in minimising any consequences of their treatment around symptoms such as fatigue, breathlessness, and lymphedema, which we'll be hearing of course. But rehabilitation is so much more than this. It's beyond diagnosis and treatment. This is actually very much the start of people's journey when they get their diagnosis. But many patients will actually need help in adapting to their new life and kind of fulfilling life to their potential during and after their cancer diagnosis. Next slide, please. So what do we know about how patients are managing with cancer? Well, the NHS England now runs the National Cancer Quality of Life Survey, which is a survey for people in England with a cancer diagnosis. And they're invited to complete this 18 months on from their initial cancer diagnosis. And it's to look at how their quality of life might have changed. So this is data from the April 2023 data release, and we know that 18 months on from a cancer diagnosis, according to the EQ5D index, patients rate their quality of life quite highly at 74.2 out of 100, but this is lower than the general population, which is 90.1, and there's definitely room for improvement. And what we also know from the Cancer Quality of Life Survey is that people living with and beyond cancer are significantly more likely to report a problem across all 5 aspects of health. So that's problems with things like mobility, self-care, usual activities, pain and discomfort, anxiety, and depression. And these differences are particularly marked for usual activities, and this includes things like how people are managing with their work, their study, their housework, and also things like their leisure activities and their mobility. Next slide, please. So at least one in 4 people living after cancer treatment in the UK actually do face long-term effects of treatment, and this can include a wide range of physical, psychological, and social consequences. And some of these consequences of cancer might not arise for many months or even years after the treatment has been completed. One example is that cancer patients are 1.5 times more likely to report problems with anxiety and depression, and many may require emotional support. And then we know from the cancer quality of life data that other common lasting side effects are things like difficulty with sleeping, fatigue, and also constipation. So rehabilitation does play a really important role in the care of people living with and beyond cancer, and it's likely that the demand for services will continue to grow as we know that our population is aging. So some statistics here for you are that by 2030, it's predicted that 73% of those living with or after cancer will be aged 65 and over, and they're likely to be living with comorbidities and complications. And that's in addition, of course, to the consequences of their cancer treatment. So we're going to be, seeing a lot of these patients. Next slide, please. So cancer rehab is really an integral part and is an essential component to high quality cancer care. It shouldn't be thought of as a bolt on or an add on because it really is integral to this high quality and cost effective care. So there's a description here of cancer rehab, but I'm not going to spend time reading out the whole description, but I've kind of highlighted some key words. And really, when we think about rehabilitation and this umbrella term, we're thinking about what support we're providing to help patients maximize their ability to function. And that might be their physical function, their psychological function, or their vocational function. We're trying to help promote patients' independence and help them to adapt to their condition. We're looking at trying to support and offer patients a major route to improving quality of life, and no matter how long or short the time scale. What's really important when we think about rehabilitation as well is that we're actually very much concentrating on focusing this around the individual patient and what matters to that patient and their family. What is it that they want to do? What are their goals and priorities? And what are any barriers or concerns that they face? Rehab is very holistic in its approach. It's multi-dimensional and often multidisciplinary, and it considers physical and psychological health, as well as thinking about other needs of patients. So thinking about things like their spiritual, social, and environmental and financial factors. Next slide, please. So, as I've already described, cancer rehab is very holistic and multidimensional, and there are a number of different professionals who can be involved. And it really is everyone's business. So, everyone needs to be aware, and everyone should really be getting involved with cancer rehab. And there are a number of specialist professions who are involved as well. So that's from professions like physiotherapists, like myself, who might help with things like mobility, balance, exercise, but also some symptom specific management around things like breathlessness, fatigue, and pain. And then just to pick up a few other examples, we have professions like dietitians supporting with nutrition and weight management. We have obviously our medical and nursing colleagues, pharmacists. We have OTs who will look at equipment and driving work and home assessments, but also so much more than that as well. They'll be looking at things like other symptom management around fatigue, breathlessness, cognition, sleep, and things like vocational rehab. So I feel even this as much as I like this diagram, even this in itself doesn't really show the scope and breadth of cancer rehab and everything that all the professionals do within providing cancer rehabilitation. Next slide, please. So this image shows what can be considered to be a kind of typical cancer patient's journey, and there are 5 key moments. So thinking about diagnosis, treatment, recovery, and also living with treatable but not curable cancer and end of life care. And it's really important to kind of highlight and reinforce that cancer rehab is appropriate at every stage of this cancer journey. So from point of diagnosis or even pre-diagnosis, all the way through to end of life care. But obviously the type of rehabilitation, who's providing it and where they're providing it will be very different according to the patient's needs. And as I said that before, that's why it's so important that cancer rehabilitation is everyone's business. And that's why we need to work across boundaries and across different settings as well. Next slide, please. So this is the model of cancer rehabilitation that has really stood the test of time, because this was originally from kind of 1980s, and it talks about the different stages of cancer rehabilitation, and it's not linear, so patients can move back and forth kind of between different stages. But I'll go through some of these now. So if we start with preventative rehabilitation, this is about reducing any potential disabilities, so through things like education, and it's often about fostering self-management and addressing wellness and health promotion services that might help to prevent illness. So often that might be things as well like promoting public health agendas, promoting things like physical activity, nutrition, and it also can be about supporting patients to optimize their health in preparation for their cancer treatment. So many of us will have heard of prehabilitation, for example. Supportive rehabilitation is about intervention to optimize function for those who are experiencing disabilities during or after cancer treatment. But this is about supporting people to adapt to their disability and disease. Restorative rehab is an intervention to alleviate functional impairments and about supporting people to try and restore their function. And again, as with all of these, this can be physical, psychological, vocational. And then palliative rehab is very important as well. And it's about supporting patients to maintain function and maintain a good quality of life through minimization of complications and helping with things like symptom control. Next slide, please. So I put this in here because I think often rehabilitation is the word that's very hot on everyone's lips, and it's incredibly important. But I also think it's incredibly important to think about how prehab fits within the whole picture and fits into the continuum of cancer care. So prehab is about impairment prevention, and it's about supporting patients to kind of prepare for anticipated stress and impairments. And we know that it can be very effective in helping patients to reduce their length of stay and reduce complications. And also, what we know from prehab is that if patients engage early on with interventions such as exercise, they're more likely to engage down the line as well. So it's really useful tool. Rehab is also incredibly important, but this rehab is more about impairment response. So it's about addressing and supporting people with impairments that are a result from their current or previous treatment. Next slide, please. So there are a number of different symptoms and concerns related to cancer and its treatment, and it's don't have time to talk about all of these because we could spend a day talking through every topic and the management of every topic. There are, of course, a number of tools as well that can help support clinicians with identifying these concerns. And one that a lot of people will be familiar with is the holistic needs assessment. But other services do also use a number of other tools. So things like a rehab screening tool or kind of general functional outcome measures, quality of life outcome measures, and then you can get outcome measures that are specific to each symptom as well. But you're not expected necessarily to be an expert in managing every single one of these symptoms, but what's really important is being open and being able to have conversation about patients, utilizing the resources and tools that do exist. Some of the key symptoms that we do see are things like fatigue, difficulty with sleep, mood, pain, difficulty with weight loss or eating and drinking, other things like lymphedema, and then, of course, concerns around things like working or return to work and financial difficulties. And this isn't an exhaustive list. This is just an example. And what is really important as well is kind of coming back to what I said before about really focusing on what is important to the patient. So, for example, you might have someone who actually their goal is that they want to be able to look after their grandchildren, but they actually face a number of barriers to be able to do that. You might think, okay, they can't look after their grandchildren because they're feeling really fatigued, as that's a very common symptom that we see with cancer patients. They're feeling fatigued and they're struggling with being able to, with their mobility and being able to kind of pick the children up. But it's about when you then ask questions about that and delve deeper, you might find out more. So you might find out that actually some of this fatigue is because they've had weight loss and deconditioning. They're really struggling with that appetite because of chemotherapy. They're struggling with nausea. And then there can be a number of different people who can support with that. So you might have a dietitian involved for support around kind of the nutrition, counselling, and weight loss advice. You might also need to include the nurse to support with symptom management around the nausea. And then, of course, from a physio perspective, you might be supporting this patient with strengthening and exercise to prevent deconditioning. But fatigue is also multifactorial. So you might actually find out their fatigue is also caused by the fact that they're not sleeping well. They've got stress, which is stopping them from, or, they're worrying about, they're sitting in bed worrying about things at night. So they might need support for that as well. And again, there can be a number of different services that can support with that. So things like an OT to go through some management strategies around sleep, or maybe support with sorry, I think I'm back, but I got lost for a second there. So patients might need support, a universal support, or they might need a more targeted and specialist approach. Next slide, please. So unfortunately, I don't have all the answers, and we do know that there can be some gaps in services, and it can sometimes be difficult to know what's out there and to access the right services. And but there are lots of things for us to be working on, and there are lots of opportunities to improve the way that we work. So it's really important that we do talk about cancer rehab, because if we elevate the voice of cancer rehab and talk about cancer rehab, we can start to ask questions about what is required and what are people's unmet needs, and what services don't exist as well that we kind of need to try and kind of work on or improve. So I wanted to highlight here as well some points that came from some work done by TCS.
I think we've lost you a couple of times.
Oh, I think I'm back.
You're
Can
back
you hear
now,
me?
yeah. Can hear you now, yeah.
So some of the quotes here are around kind of communication and around services communicating with each other. And I definitely think that that's something that we can work on, because I think sometimes patients do face this difficulty in feeling that services are really disjointed. And obviously that's one of the purposes of this community of practice as well. It's about kind of cross-boundary working and kind of trying to improve communication and networking. And the other thing I think really to be aware of is some of these quotes at the bottom, which are around kind of when you're receiving cancer treatment, you're at the centre of attention, and you're not thinking ahead to the day when you're on your own and needing to access services and how you'll go about this. Often it's kind of thinking, people don't realise that kind of it might be a year, it might be 2 years down the line that people are actually needing that support. So it's really important to be aware that kind of the long-term consequences or the late effects of cancer treatment might not be apparent straight away, but can kind of can occur later on. Next slide, please. So when it comes to cancer rehab and support for patients, sometimes it might be necessary to think outside the box and really have a think about what services kind of are out there and do exist. So there are a number of specialist teams kind of working in cancer centres that work within inpatients and also outpatient services. And they might be providing tumour specific support, or they might be providing support around specific symptom management as well. There will be inpatient services, but also sometimes the outpatient services will support with things like groups. It might be virtual groups as well. They might be able to support with signposting to other services as well. And also hospices are a great resource, and they often have a number of really fantastic resources to support with symptom management. So there are groups around things like fatigue and breathlessness, or maybe emotional support groups as well. But I'm sure we can all appreciate as well that sometimes after treatment, patients might not want to go anywhere near the cancer hospital or go near the hospice either. So those aren't always appropriate for everyone, but actually we need to be thinking about all the other services that do exist. So community teams, there are some specialist community teams like the community head and neck team. But there's also other community teams, and all of the community teams, so things like community physio, OT, and dietitian, they all have a role to play in supporting with cancer rehabilitation. There are also a number of different specific groups. So there might be groups that aren't specific to cancer, but that can still support our patients with a lot of their symptoms. So things like psychological groups of psychological support, groups for exercise to help with balance and falls, groups to support with breathlessness, weight loss, and also sleep. There are long-term condition groups that can cover a range of symptoms. A number of London boroughs also offer exercise and referral or have social prescribing services that can be really useful to tap into as well. And often I find that we do refer quite a lot of patients from specialist services onto things like exercise and referral, which can be really useful. Charities can be really useful too. So they can be cancer specific charities, things like Macmillan or Maggie's, but also other charities that are not specific to cancer can support our patients with some of their needs. So things like Age UK or Red Cross can be useful to consider when we're thinking about a holistic approach to our patient care. And we also need to consider things like complementary therapy and apps that can help with healthcare. So, for example, Headspace app or the Silver Cloud app, which is free if referred into IAP services by a GP. And that's got things like a really great 6-week sleep program that can be helpful. Next slide, please. So one really useful resource that I found quite useful when working in oncology services is the Cancer Care Map. And this is an online resource to help people living with cancer to find support services that exist in their local area. And it covers anywhere in the UK. And the website is actually run by a cancer charity, the Richard Dimbleby Cancer Care Fund. So they are very good at keeping it up to date, which is obviously incredibly helpful. And there's a huge range of cancer related support across the UK. And this covers things that are run by charities, NHS organisations, community groups, and also some small practices or private companies. So you might be able to go on here and kind of search for what you're looking for, or search by area and find information on things like counselling and emotional support, or health and fitness, or difficulty support with nutrition and well-being, financial advice. So it can cover quite a lot of things. Next slide, please.
Faye, just a 60-second warning if that's okay.
Perfect. We're not doing too bad. So I'm on my last couple of slides, and really what I wanted to put in here was further training and education resources for people who are really interested in kind of increasing their knowledge around cancer rehabilitation and other things, because obviously, as I said, this is just like a whistle-stop tour. And these can be kind of shared, and I know this is being recorded, so you can kind of access this again to have a look. But there are things like the Macmillan Learning Hub, and there's a number of useful courses on there. The Prosper program as well, which provides e-learning to support people with cancer in personalised care, support planning, prehab and rehab. Health Education England have an e-learning session on physical activity and health. And if we go to the next slide, there's more because I was really excited. Another couple of options. Moving Medicine has consultation guidelines on physical activity again. There's the Ascend webpage to have a look at, and then some more also psychological therapies e-learning, which is on the NHSE website. And then last slide. The other things to have a look out for are e-learning and also education days that can be found through things like Guy's Cancer Academy, the Royal Marsden, and also things like the Hospice Education Learning Program, Learning Partnership. So some great education sessions run by some of the hospices as well. And thank you. Last slide is just to say, if there's any questions, then please, we'll have a quick pause to see if there's anything that anyone wants to ask me.